Welcome to the K in Clarity podcast. I'm the host, Mezue. During this episode, we're joined by Eziah Syed, CEO at Mend. Eziah Syed has been instrumental in pioneering evidence-based clinical nutrition solutions within the digital health and food as medicine space. Syed has led the development of innovative products that enhance patient outcomes and address undernutrition in various populations. With his work, he has positioned Mend as a leader in the food as medicine movement, with its products being adopted by numerous hospitals, professional sports teams, and the U.S. military. In this conversation, we discuss a little bit about the critical challenges facing the U.S. healthcare system, emphasizing the need for a shift towards preventative care and a holistic approach to wellness. Syed also explores the role of government in healthcare, the innovations being made in digital health, and the unique approach of his company, Mend, which focuses on nutrition and remote patient care. Also, we discuss the complexities of navigating the healthcare landscape, particularly in terms of adoption, identifying early adopters, and understanding organizational dynamics. The discussion also covers the pros and cons of value-based care, the potential for hybrid care models, and the need for innovation in the healthcare space. Syed also offers valuable advice for entrepreneurs looking to enter the digital health sector and shares insights on future trends and innovations for other industry leaders. If this is your first time tuning in, here's the gist. The healthcare industry is buzzing with innovations, but there's a lot of noise and misconceptions out there. That's where we come in. Because of my experience in the healthcare ecosystem, I've gained a unique vantage point into the industry's inner workings. We're bringing you the conversations that typically happen behind boardrooms and strategy sessions, the real challenges, innovative solutions, and game-changing insights that are reshaping healthcare as we know it. On this podcast, we bring you face-to-face with the industry-leading healthcare founders, executives, and innovators. We're talking about the nitty-gritty about building and scaling healthcare companies, the hurdles they've overcome, and the strategy that have led to their success. More importantly, we dive into the personal challenges that come in trying to change a system as complex as U.S. healthcare. So whether you're a healthcare entrepreneur, a medical professional, or someone just passionate about the future of healthcare, this podcast is your backstage pass to the minds shaping the industry. The K in Clarity podcast is proudly supported by Kemora.co, a growth partner firm that works with digital health, telehealth, and healthcare tech companies to overcome growth and operational challenges and drive changes in the U.S. healthcare system. So if you're running a telehealth or digital health company facing growth challenges, check out Kemora.co. They might just be the partner you need to take your impact to the next level. Now let's have Eziah Syed tell us a little bit about themselves. Welcome, Eziah. Thank you very much for joining the podcast today. For the people listening, could you tell them a little bit about what you do and what's going on with you right now?
Yeah, thank you for having me. I appreciate the opportunity to discuss a topic that's really important to me personally, and obviously to my company. I have spent my career in strategy and innovation for firms like Deloitte and Citibank, really thinking about big shift domains, and I've become really passionate about the state of health and healthcare and the crisis that we're in. We spend a lot of money, $4.5 trillion to be precise, in our healthcare system, which is more than on a per capita basis than any industrialized nation. We're not curbing the tide on illness. We're getting sicker. And so as I reflected on that in the context of my family and some of the things I've experienced, I started a company called Mend, which is at the forefront of food as medicine, really looking at evidence-based approaches to utilizing nutrition as well as digital behavioral health, and how do we bring those two together in a platform that really has an impact, which I'm sure we'll unpack for you over the course of the discussions. I'm founder and CEO of Mend here in New York City.
Perfect. I love that. So we usually like to start off our conversations with an icebreaker. So first icebreaker I have for you is, if you can combine your expertise in digital health with any revolutionary technology in the works, what would it be, and how would it revolutionize healthcare and really help change the healthcare system?
Yeah, and you picked an easy question for an icebreaker. It's a big question, but because digital health is obviously a really big domain. Look, I want healthcare to be more a preventative and wellness focus versus illness and disease focus. Right now, the entire emphasis is on when you get sick, when you've been diagnosed with something, what is the intervention involved? And I want it to be lower cost. I want it to be more equitable. So if I can use, which I am doing today with men, if I can use digital health with some of the advancements that are happening in AI and behavioral models to get people, first and foremost, breaking the habits that we've developed on eating really poorly. 60% of the American diet comes from ultra-processed foods. It's a crisis. Being more active, getting more sleep, getting more sunlight, socializing more, doing all the things that we know are the core drivers of human health, leveraging technology for that versus only leveraging it for the point at which we get sick. I think we can get into a prevention-oriented and wellness-oriented system that will save us significant dollars, not to mention the incredible amounts of human suffering involved. So I think there's a lot to unlock in how we use digital health, AI, as well as nutrition and all the things that we know are core drivers of human health.
Yeah, I love that. I think one thing that people tend to ignore is that prevention, right, is better than care. That's what my grandma used to say. And so what's something that you think people don't typically understand about that, especially as you kind of drove into digital health?
Well, healthcare has become so hyper specialized in our world, right? So if you're a surgeon, you're not just a surgeon in orthopedics, you are a knee surgeon or a hip surgeon or you're a foot and ankle surgeon. And so the level of hyper specialization means that people go in and they study a very narrow specialty, and we don't think about the person as a whole person. And we don't think about kind of what I call, or, is commonly known as the biopsychosocial model of healing and well-being, that the biology is involved, the social environment's involved, the psychological aspects involved in wellness, and all of these things really matter. So, my mom, unfortunately, was ill recently with an infection that got her hospitalized for 2 weeks, and I was in the hospital environment, taking care of her. And you could just see that no real deep thinking went into how do you create an environment that's conducive to healing. Right? The lighting in the place is completely off. There weren't windows. You're hearing beeps and sounds everywhere. It's cold. It's this, that, the other. I could go on and on and on. The food being served was not optimized for healing. And so we're so specialized that we think about the cut and the medicine, but we don't think about the totality of what's involved in a true biopsychosocial model of healing and wellness. And I think that's largely ignored. There's, Casey Means, who's an MD herself, was recently in a congressional hearing on food and health that was hosted by RFK, and she said, in my Stanford training, I got almost zero training in nutrition, like virtually we didn't even touch it. And so, doctors simply aren't trained to think about kind of the full context of it. And I think that's another area where we need to move into a much more integrative approach to thinking about a person's wellness, and a lot more connectivity between these specialists, so that we're in a whole person, perspective and approach versus just a very narrow specialized approach.
Gotcha. Is there anything that you think is particularly challenging that has kind of shaped your approach as well with digital health that you think can be integrated in that new holistic model? Because I think that's something that can be very beneficial towards what people are thinking, and they want to implement it, right? You usually hear that, but the problem is, okay, now how do I do that?
Yeah, and unfortunately, that's the reality. There's a surgeon who I work with. I hold him in great esteem. Dr. Vendasa posted on LinkedIn. I think I saw it about a week ago, saying we need to forge ahead with innovation in healthcare. But a lot of the innovations we see are trying to advance healthcare versus helping us to put out the fires. And what he meant by that is, like, if you look at the P&Ls of health systems for the past while, they've been bleeding money, and they're short-staffed. And any stat that you read on, their workloads, caseloads are going up. We're, retiring. A lot of people are retiring daily. We're older. We're sicker, so on and so forth. They're struggling to just keep the business, keep the lights on, if you will, versus advance the business. So in my particular case, my mom was diagnosed with cancer, and I saw the lack of care, right? So when my brother had a pretty big fall from Catskill Falls, upstate New York, 80 feet, he fell, he got significant trauma surgeries. But apart from this really great care in the hospital that they both got, there was total absence of care or anything provided outside of the walls of the hospital. And so I think there is enormous promise in leveraging digital health, telehealth, and technologies to get care more distributed and get it out of just this narrow, centralized model, and leverage technologies like biofeedback and remote monitoring and telehealth and precision medicine and personalized medicine to really start to get into a care model where care is in every home, right? So we can detect, we can treat, we can monitor, we can do all those things in a much more accessible way, and that'll also address another thing that I'm really concerned about is healthcare equity, and how do we make sure that it's not just the wealthy that can get really good healthcare, but good healthcare is accessible to all.
Yeah. Could you speak on that, the healthcare equity, and what you think people should know about that?
But I think I come from Canada, right? So I've been in the U.S. We tend to call it socialized medicine, and we've demonized it as this kind of evil where government controls medicine. That's not the fact. That's not the case. The idea is in Canada, there's a base level of care that's kind of available to everyone. It's a public payer, single payer based system. And I'll just give you an example that brings it to life. There was a single year in which my father had a stroke. My aunt and uncle both had to have bypass surgeries. My mother was diagnosed with cancer for 4 major illnesses. That if I were in a U.S. healthcare system context, I was in Canada at the time, the amount of copays and insurance denials and all that kind of stuff that I would have been swimming in, I would have been under extreme financial duress. In Canada, I didn't have to think about the financial implications of any of that, and they all got really great care. So to me, healthcare equity is about ensuring not that if you are affluent and you're wealthy, you can't pay for something better. I'm not opposed to that, because that's the world we live in. Affluence allows you to buy certain things and access certain things that other people can't. But that there's a safety net of a level of quality of care that's available to every human being alive. I think it's a moral and ethical responsibility that we have. And so that's what healthcare equity is all about, is that not everyone is getting, there's huge disparities. It goes by socioeconomics, it goes by demographics, it goes by the neighborhood you live in, on the quality of the care that you have available to you. And it's really a moral blight.
I think the issue that some people usually have, right, is there's so many stakeholders, especially involved in the U.S. healthcare system. What do you think can be done to, I guess, align incentives? Because it's really challenging, right? I think a lot of people in healthcare, they want to elicit change. They want to elicit things that are good and beneficial to the end patient, especially. But it's hard to align the incentives in a right way because some people might want better compensation. There's other factors, but what do you kind of have to say to that as well?
Unfortunately, I don't think there's a panacea. It's a major problem. The incentives problem is a major problem, as we all know. There was a tragic shooting of United Healthcare CEO, this week. And I constantly see in my LinkedIn feed, because I work a lot with doctors and surgeons, them complaining. And my brother is, through physical therapy practices here in New York. And every single day, it seems like he's discouraged because his insurance reimbursement rates are just being cut. And he's having to operate in a business that is going to have to drive volume, lots of patients through the system, for him to be able to make the kind of money and sustain his business, and he wants to provide high quality care. So there's an incentive problem right there that the insurance companies have been making record profits, and yet the hospital systems are bleeding money, and the rates continue to get cut, and so on and so forth. So we're in a real pickle and dilemma as it relates to the incentive model and how do we get the entire system aligned. And this is where I think there are certain domains, whether we like it or not, as a core fabric of how we think about society and the design of society. We're in a capitalist system. We embrace capitalism. Capitalism drives innovation, it drives wealth, it drives all those things that we cherish as a society. But there are certain domains in which we really need to think carefully about the encroachment of capitalism in such a way as it really is detrimental to what we're ultimately trying to achieve. I think healthcare is one of those areas where we're really going to have to start to really think hard about government involvement and policy involvement to ensure that the externalities and the costs and the things that can really be damaging to us as a society are very carefully thought through and prevented. The food industry, the food system is an example. 60% of our diets are ultra-processed foods. They're feeding incredible amounts of disease. We know it. All the data is there to prove it. But we have a system in which food companies can continue to pump out sugar and fat and salt and stuff in foods that are highly addictive. And that's where government has a role, right? Government needs to step in and ensure that we have, and it's happening. Unfortunately, some of it far too late, but now they're going to put warning labels. This is new legislation that clearly labels when you're picking up a food product from a grocery store that says, this is very high in sugar content or high in salt content. and you should know about that. So I think healthcare is the same. We have a system that has multiple entrenched interests, and their financial incentives aren't aligned. And unfortunately, when you're in that kind of a system, you can't let the market just figure it out, because it's going to come at a huge cost to human health that government's going to have to get involved. We're going to have really smart policymakers.
Yeah, I love that. I think one thing that I heard from somebody else that he was talking about is now capitalism focuses on growth. Sometimes I think capitalism has a lot of unique benefits that it can apply for us, right? But I think additionally, how can government play in a way, in a structure that kind of creates something that people can play in, right? And allow for capitalistic means to actually provide benefits and solutions to consumers and patients, right? And so what do you think the relationship between that government and potentially, providers and other stakeholders that are involved to allow that framework to actually happen? Because I think that's something that is the challenge of where do you find that balance and where do you actually strike that?
Yeah, and again, so there's a lot of people expounding for what they call in capitalism 2.0. So we figured out a system in capitalism 1.0 that we saw historically drove innovation and entrepreneurialism and growth and wealth. We know from the data that it has done that, but we know that it's not a perfect system. We know that it comes at great costs. It creates disparities. We're living in a time now where we have incredible disparity in wealth. Like, it's staggering that the disparity continues to grow, that a small percentage of people in the world they control the wealth, and the vast majority live in almost in abject poverty. And that's a cost of a system that enables that. So as it relates to healthcare, again, I can't give you one single panacea. We're going to have to go, system by system, structure by structure, and really think about the incentives and what kind of a society we want. Like in Canada, you don't hear doctors generally complaining about the amount of money they make. On average, an orthopedic surgeon in Canada makes around $350,000 to $400,000 a year. Now, in most countries, in most places, if you're making that kind of money, $350,000 to $400,000 a year, you're living a pretty damn good life. You're doing well. You've got your home. You're not worried about bills. You got a nice car. You can take vacations. You can do all that kind of stuff. But in the American system, because we're so accustomed and we're so socialized to seeing people become millionaires and billionaires, and we lionize them, we hold them up on pedestals as that's what we all should be aspiring to achieve and aim for. We have doctors and surgeons and others that are making really great money that are completely unhappy with the amount of money that they're making because they feel like they should be making more. So there's a lot that I think we need to rethink and redesign as it relates to healthcare. Is it a single payer system? Will that solve everything? I don't think we'll get there in this country ever.
Yeah.
I think the interests are too entrenched, and I don't think the population wants that. But is there a tiered system? Right? So is there a system where we have both single payer, government pays, Medicare is a wildly popular program. We don't call it socialist. Medicaid helps support people that are under lower income. We don't necessarily call that socialist. So is there a better tiered model that we can create that allows those folks that want to play in the elite space? So if you're a doctor and you want to make a lot of money, then there's private practice for you catering to people who have elite insurance. If you're a doctor that is okay with the $350,000 or $400,000 and perhaps work-life balance and other things, you can play in that space. And there's a different model. I don't know the answer. I don't know that there again is a single solution, but I think having a very well thought out policy framework that really thinks about costs are out of control. It's unsustainable. Illness is out of control. It's unsustainable. We have to break the back on this model, on this approach, because as I think RFK or maybe said in his hearing, it is an existential threat. This is a bigger threat than, the risk of nuclear war, because there aren't that many risks of nuclear war happening. This is a bigger risk than, another pandemic for potentially of really causing very significant long-term harm to our country. And we need to think about it that way. We need to think about it with that level of urgency. that this is existential and it's going to take radical change, not incremental change. It's going to take some very, very bold policies. In Australia, they just banned social media for anyone under the age of 16 because the data has now become unequivocal that since the advent and introduction of social media, the incidence of adolescent depression, anxiety, etc. has gone up. And they've done studies on this and they know the underlying drivers. It's peer and social pressure. It's too much screen time. It's the dopamine hits that are happening. It's a whole bunch of things that's driving it. That was a bold policy move. They're going to fine you as a social media company if anyone under the age of 16 is on your platform. Right? It takes that kind of leadership and vision and courage to have an impact, and we're going to need that kind of vision, courage, and leadership.
Yeah. I like that point. I think it comes with bold, right? Things that come with bold, sometimes they come with, different failure points and challenges, right? So that doesn't necessarily mean that, something that is going to be a bold policy will actually elicit the same type of change that we want to see. I think switching on that, and I think that's a good point that of, hey, something bold that needs to be done. Another thing that I talked to somebody else about was, hey, actually bringing the decision, the choice down to the consumer, right? Because allowing change to happen in a B2B model can be very, very hard. So, but a lot of people might go into that, right, and wanting to do B2C, but they realize, I don't think I can actually get this done the way I want to because there's so many stakeholders, there's so many interests, right? They usually tend to switch to B2B or working with the government in some type of way. So I wanted to touch on a little bit about what you're doing at Mend and what you think leaders could probably take from that to actually have some change and maybe the advice that you'd give to them to actually allow that to happen.
Yeah, look, there's really two innovations that we have worked on that I think will be really important going forward in a healthcare model. One is getting more focus back on nutrition. So we've got what we call food as medicine platform. What does that mean? That means with our ingestible medicines, I'll call them that, even though we're not allowed to call it medicine through FDA rules. It lives in the nutrition world, but we've done randomized trials, we've done mechanistic studies, we've looked at the hard science of how it impacts certain key biomarkers. And so when you take, for example, which I take daily, our daily inflammation pill, it hits 5 or 6 inflammatory markers that we know are bad, we know go up with age, we know go up with bad food and stress, and so on and so forth. We have a product that lowers blood sugar and stabilizes. We're in a blood sugar crisis. The average U.S. consumer is consuming 3x the level of sugar. It's insidious, the impact blood sugar has on your system, and so we have a product. So there's food as medicine and there's actual food. Right? So the whole foods that we need to get back to eating, whole foods plus the right ingestible exogenous molecules that have been well studied that can have an impact. So really designing around that as a core tool and modality that we use. Then there is the distributed healthcare model that I talked about, which is getting more prevention type of tools into homes as well as monitoring and diagnostic types of tools. Mend is a platform that has brought it together in a single capability. Now we're deployed right now in an acute care model where someone who's 70 years old is about to have a major surgery. Instead of being told, about to have let's just take knee replacement as an example. My mom had a knee replacement at 79. Instead of being told, here's your surgery date, show up, and here's, a few things you should avoid and a few things you should do. In our model, my mom would be under the care of dietitians, nurses, health coaches that are remotely coaching, guiding, monitoring her all the way pre-operative and post-operative. She would get a set of nutritional products that are optimizing her for that surgery. Getting a joint replacement is the equivalent of running 1.5 marathons in terms of metabolic demand. You're going to burn 4,000 to 5,000 calories. Imagine sending a 75-year-old into a marathon without any of the readiness or any of the recovery protocols and not introducing risk to that. I mean, that to me is crazy. But that's what we do. We say, show up for your surgery on this date, and we might give them, the more sophisticated doctors, or Dr. Wickline's one of our partners, Dr. Jacob, have put together their own booklets that show the patient kind of step by step, what you're supposed to do. We're taking that approach to a whole new level with digital technology and food as medicine to ensure that patients have comprehensive care through the entire episode of care. Our platform then becomes extendable to any type of a healthcare context, because ultimately what we're doing is we're coaching, monitoring, guiding through remote technology and digital healthcare and interacting with the patient in real time. And we're giving them food that fights disease, doesn't feed disease. And that is, we think, a paradigm change that will be a cornerstone of healthcare going forward. So we've lifted in acute care. We're seeing incredible amounts of patient satisfaction rates. Patients are saying 0.7 out of 10 for quality of care, quality of clinical care. 93% in one of our surveys said this is the best healthcare experience they've ever had. A 9.3 on Net Promoter Score. And so this is happening in real time. It's changed slow in healthcare, but we've developed something that we think is very impactful.
Okay, I love that. I think speaking to it, right, what do you think is something that I guess providers could take from that? Is it that they now implement a model similar to yours, right? What do you kind of think is something they could do and actually take away from them?
Yeah, one of the other articles I recently read in healthcare is are there too many pilots in healthcare? Right, because it's such a risk-averse mindset in healthcare because we're a litigious society and we worry if anything goes wrong, the patient's going to sue us and then we're in deep trouble. So what we do is we do these small, tiny little pilots, and healthcare systems are constantly in little pilots, and nothing really advances at a level of scale with any speed or efficiency to have significant impact. And so my example is, we've lifted our program in multiple environments and shown the impact. Yet if I take it to any large system or large private provider, guess what they want to do? They want to pilot it, right? Even though it's deployed and scaled in another system and you can call them and get the testimonials and get the feedback, they still want to pilot it. So what I would is, I come from the innovation space. That's what I've spent my career in. Is healthcare administrators really need to start to think about more boldness. I know risk aversion is critical to how we think about healthcare and making sure that we're doing things in a sound way. But when there is a solution that is already been proven in other environments, do you really need to pilot it? Or is it something that you can be more bold about, and can you really start to implement and scale so you can have an impact? So that's one of the things that I would really start to encourage healthcare administrators to kind of think about doing.
Gotcha. I think when people think about it, right, there's usually a reason why people used to do things the way they used to do them, right? And so I think that's the challenge, right? And I think I've heard that from other healthcare leaders as well is, hey, you might provide all the data, all the information, right? But sometimes there's still, no, I'm sorry, we just can't implement that, or we're going to have to do something like that. It's not evolutionary, it's not innovative enough, right, to actually elicit that change. And so I think what's a framework that potentially these healthcare systems can use and start to think about to actually become bolder, or a framework that they can choose that allows them, when they see that data, they can actually want to implement it. Because I feel like there's a lot of times that, even as I mentioned previously, that data is provided, still they don't have a framework to know, hey, actually, this is something I should choose. I should hop on this right now, right? So is there a framework that you can give there?
Well, at the level of corporate strategy, which is the world I come from, and it applies at strategy level, at a healthcare system level, there's a framework called total innovation. And total innovation says, how much of your time, energy, resources are you investing in incremental innovation that's going to drive every single day, Kaizen, new improvements, minute small little changes that are driving near-term immediate impact. How much energy, time, resources are you allocating to adjacent innovations? So things that you can readily take that are core capabilities of yours and start to lift new capabilities into adjacent spaces. And then the final is more radical, disruptive. And so in the corporate world, there is a recommended allocation of how much time and energy resources are you spending in each one of those buckets. Now, I think healthcare systems can use a similar approach, which is do we have a portfolio approach to how we're looking at innovation, and are we allocating our resources, time, and energy appropriately in each one of these buckets to drive the business forward? Because you can't ignore, in the corporate world, the data shows that 10% or 15% that you're allocating towards the more disruptive stuff will actually drive 90% of your revenue going forward. Now, I don't know how that translates into the healthcare environment. I'd have to kind of really go deep and look at that. But it's a framework to think about making sure you're not ignoring, right, the important stuff that's going to change. Technology is evolving at an exponential rate, and our brains don't think in exponential terms. So when you see something today, we're thinking about the linear progress. So look how quickly ChatGPT kind of has advanced, and the whole generative AI space has advanced, and it's in its infancy. I guarantee you in 2-3 years, we're going to be astonished again at kind of where it is at that time frame. So you can't afford to ignore disruptive stuff, because it will blindside you and you will be outdated quickly. And so it's really, really important to be making sure that you're allocating a sufficient amount of your energy, time, resources into those really bold, disruptive things.
I love that. I think talking about innovation, right? We can't ignore AI, right? And the potential changes, right? There's a lot of hype behind it. What is your thoughts behind AI, especially maybe in healthcare delivery, but any other aspects of healthcare that you think people can take away or start to implement?
Oh my God, there's so many areas that it's impacting, right? So diagnostics
Right.
already in imaging.
Yeah.
We know that in imaging space, AI has shown in numerous tests and studies that it's more accurately reading imaging than even doctors can. There's certainly on the more personalized medicine side of things, as we are able to map the entire genome and really understand exactly what genetic-based medicine, right? So what are you going to respond to? There's so much going on in drug discovery that AI is impacting. There's risk detection. So can we, in our platform, we've already, and this has not been really thus far AI enabled, but human enabled, in the future it'll be AI enabled. We have intervened with patients where we detected risk. The most recent patient, my clinician said, look, I really think you should go to ER. I think you had a stroke. The patient was just like, wait, I was at my primary care doctor yesterday. I was totally fine. And called the doctor and said, look, these are the symptoms the patient's presenting. And that wouldn't have happened if we weren't digitally remotely monitoring that patient. So that's risk detection. There's obviously on the administration side of healthcare, that's a huge amount of cost. It's the bane of a lot of clinicians' existence. Like my brother's always complaining about the amount of paperwork he has to do.
Yeah.
And so, that can be a huge area. And then, virtual assistants, right? We're an assistant to patient. We're monitoring, supporting them daily on the things they're supposed to be doing. But we can use a lot of virtual agents and assistants to help every aspect and get really into that prevention side of things.
I like that. What do you think is the balance between technological innovation and that human touch in healthcare, right? I think a lot of people, especially now as AI is becoming more prevalent, more things are potentially being automated. You're finding that level of, hey, we have to bring the human side to it back, right? Of course, we'll see how change, develops over time. But what do you think about that?
I think it's a great question. I don't have a specific metric on, the balance between human and technology, but I will emphasize and overemphasize the importance of human to human interaction in a healthcare context and healthcare model, because we are an ultra social species. If you look at my net promoter scores and you look at the verbatims that we're getting from patients, the verbatims clearly show that patients are valuing that human to human interaction that they're getting with my clinicians. And I guarantee you that if it was a chatbot just sending them reminders or updates or what have you, you're not going to get. Now, I get certain chatbot reminders from my healthcare provider, and that's nice, that's efficient. But some of the deep care that we're providing to patients and that's provided by clinicians, there's clearly an appreciation that that's a human looking after me. And that, again, the psychological impact if there's another human looking after me is far more significant than there is a technology looking after me. There's all kinds of underlying mechanisms involved in why that creates more safety. So I think there is definitely a role for automation and AI to augment care, but we got to be very careful to not try to remove clinicians from the equation. That really AI and automation needs to enable better care by clinicians versus the mindset of Silicon Valley, because they always look for unicorns and scale, is to take people out of the equation and automate as much as you can. I don't think that's the right model for healthcare. I think people to people has to be central to how we think about it, but enabling clinicians to do their jobs more effectively is where technology needs to play the role.
What do you think there's, or have you seen anything that's been maybe the most integrative or creative way of actually allowing that to happen that you've been impressed by, or somebody or company that's actually doing something like that especially to help, clinicians, physicians that are trying to actually help with patient care?
Yeah, there's a lot of companies in digital health and remote care. There's a fantastic company that's in mental health called Charlie Health, and they're helping adolescents who have significant mental health issues and challenges, and they're using a remote care model, but they have they've got individual therapy, they've got group therapy, they've got family therapy. So humans are always, and obviously always clinician driven and clinician enabled. Humans are always part of the model, but it's convenient, it's at home, it's technology driven, it's personalized because they leverage algorithms to personalize the care to your specific set of needs. And so it's a really nice balance between how do you leverage technology, but make sure that a human-centered model is at the core of what you're delivering. And I think that's really ultimately the future and where we need to go.
Gotcha. Do you have anything to say maybe in those companies that are trying to work, with other people as well in establishing themselves in that existing workflow of, those clinicians and anything of that sort to actually help care? Because sometimes it can be a challenge, right, to implement yourself and you're having a whole new system to work with what these, clinicians and providers already used to.
Yeah, I mean, I think where you're going. I think where you're going with that is, how do you get adoption and get yourself embedded into healthcare. One of the most challenging parts of selling anything into healthcare is the pace at which it moves. It is painfully slow and risk averse. And if you're an entrepreneur thinking about this space, that's one of the biggest challenges you're going to face is that early adopters and making sure those early adopters are folks that have a stature within the domain that they're in. So for example, I'm in orthopedics. Can you get to some of those folks and identify the folks that to be bold, that will try new things and push the needle, and they're like in orthopedics, you can see they're very active on LinkedIn and they're chatting, and you can see the ones that are really open to innovation, but they're ones that are also have others. That's really, I think, the core of the strategy is getting to those highly influential, bold early adopters that when they do it, the rest of the market says, oh, okay, this guy's doing it. It's got to be good, and I can jump on board. So we're fortunate that Ortho Lone Star, which is the third largest orthopedic provider in the country, has done a full rollout with us. We've done a public announcement, and that gives us so much credibility now that when we go to the next provider and say, here's the press release, you can see that this major provider is in a full rollout, it makes that conversation a lot easier.
I like that. I like that insight a lot. I think a lot of things that I've heard from conversation with other leaders and executives is that, things tend to move at a snail's pace. And so yes. The thing is, hey, right, how do you actually identify those people? Because I think the success and the things that I've heard that worked really well is, as you mentioned, even though in the same way of care, right, is a human approach, that's the same thing that you have to do as well on the business side, right? And so you have to have that human touch. So how do these companies, these leaders actually identify the people that will be an early adopter, that will, I don't want to say take the risk, but potentially take that risk, right? And be bold enough and be innovative enough to actually want to allow that change, because that's going to allow the cascading effects to actually happen with the rest of the industry. How do you actually identify those people?
Yeah, and I think that's one of the benefits you can leverage, of social media, because these surgeons that I'm talking about surgeons, but it can be any type of clinician and doctor, they all want to establish their name and their brand, and so they're publishing, right? So they want to have their voice and their name out there, and they're publishing studies and they're trying new things. So I would look at, who's got a lot of publications, right? Who is active on LinkedIn, sharing thoughtware. There's a surgeon I can think of, I won't directly name him, but he's just established a very significant profile for himself on LinkedIn with his thoughtware that he's constantly putting out. And so you can leverage all the data out there, publications, how active they are in social media, what kinds of things are they talking about, to really identify the ones that are gonna be able to actually try something new and then influence others to try something new.
Gotcha. Do you think these early adopters will have enough, I don't know if the word I want to use is gravitas, but enough pull within their organization to actually, is the industry that hard to move, right? That these early adopters won't be able to do much? Or is there any other person that can actually help support these early adopters as well that maybe need to be identified? What do you kind of think about that?
I haven't found a single, what I'll say is algorithm on how one enters into a health system. Our entry points have been different, and sometimes you'd be like, I got the chief of the department who's, a major surgeon in the system, and he's saying he wants to do this, and he gets killed by some administrator. Or, you get the head of the innovation department that wants to do something, and then the surgeon is not on board, or the doctor's not on board. So there isn't, but I can tell you that, doctors do play an outsized role in terms of their influence, because they're the ones that are driving the P&L and the revenue. They're the ones seeing the patient. And so if you can get the right doctors on board to support your idea, then you have a chance at a lift. If you can't get the doctors on board, it's dead on arrival, quite frankly, usually. Unless administration is doing a little side pilot somehow that doesn't involve the doctors, which is rare. But generally, like, I've got a call next week with the chief of oncology of a major health system. I went to administration got me to him. Now administration's on board. Now if I can get the chief of oncology, now I've got to play. I've got an opportunity with the chief of oncology saying I want to do this, and administration saying we want to do this. So you just have to be, really thoughtful about getting to the right people that will have an outsized voice on whether something advances or not.
Gotcha. So maybe you might not be able to find those exact people, but do you think there's a way that these companies and the people that want to bring change, that want to work with, these providers and clinicians, can understand the nuance within another organization? Is there a way? I'm not sure what that would be exactly, but maybe an insider, I don't know. But what do you think is a way to actually understand the nuance within these organizations?
A tool that we've leveraged effectively is, and a lot of times if you're starting a startup, partnering with people that have been in healthcare administration that have lots of relationships, have a Rolodex, if you will, that can make phone calls and get initial interest and field. So we've used these small mini discussions where we'll get 3 or 4 surgeons into a little Shark Tank type of a thing where we'll bounce our program and idea off them and get their feedback. And you can even pay them for that, because as you're paying them for their time and their feedback, and that can catalyze then a broader discussion within their organization. So I would highly encourage not trying to do it yourself if you don't have relationships, and making sure that you partner with those because it's a relationship driven business, and people open doors with other people that they know and that they're buddies with. That's just the reality of who we are as human beings.
Correct.
And so getting folks who have a Rolodex of relationships is incredibly important.
I like that. This is a little different, but it had me think about relationships I think private equity either deservingly or undeservingly gets the blame within healthcare. How do you think private equity plays a role within those relationships and maybe funding that happens throughout the system? Is there something that you could say, a note on that? I was just curious.
Well, I mean, and I too see that, right? I see a lot of folks complaining that are in the clinician side of things on private equity coming in, creating a lot of pressure on profit and margin, and us getting out of touch with quality patient care and all that kind of stuff. And that's another area where, we really need to think long and hard about our model and whether driving that much of an emphasis on profit in a healthcare context, squeezing margin, the higher volumes of patients is really where we want to go. I think the jury's out on what's going to come of this, but my hunch is it's not an ideal thing for private equity that are on their own agendas with respect to the kind of capital returns they want to drive in a context where people's lives and people's health is at stake. I don't have a set answer, but my hunch is it's probably not a great thing, in that it's going to require, again, a lot more oversight and a lot more thinking, because I hear nothing but constant complaining by the doctors and the surgeons about that whole model.
Gotcha. Do you think there's something to be said about, I guess, the incentives, or what incentives can be provided within a healthcare system as well, right? A lot of people, I think money in healthcare is one of those things that it can be hard, right, to balance. So what can we maybe said about the incentives or compensation or financial aspects of healthcare? You can kind of go with that where you want, but I think there's something to that.
Look, again, generally speaking, our doctors are really well paid in the U.S. If you look at some of the specialties like orthopedic surgeons, making more than $500,000, $600,000 a year relative to other countries, some of the highest in the world. And so when hospitals are bleeding money, which they have been for a while, how do you argue for them to be paid more, the nurses to be paid more, and so on and so forth? And so, the only way you can get paid more is if your organization is making more money. And so where does that money come from? Right now, in a model where the payers are paying less and they're cutting rates, you can only make more if you see more patients, and therefore bill more, or you reduce your costs. So they have to do both. They've got to leverage technology to create efficiencies, reduce costs. I'm ruthless about that, about being as efficient with technology as possible to make sure that cost is driven out of the system and that they're seeing more patients. And the only way you're going to see more patients is if you, again, leverage technology to a more distributed healthcare model and I as a clinician can see more patients than just within the walls of the hospital. So if they want to get paid more, those are the only two levers we have to be able to get paid more. Do I think, generally speaking, most doctors in our country are paid pretty well? I would say the answer is probably yes. But I think the biggest part of the problem that's broken is how much our payers, the insurance companies, are making, and how a lot of people feel screwed out of that equation. Pardon my language. The patients do because they get denied claims, and it's a big game. Deny until you have to pay. And the providers' rates are getting cut, and insurance companies are making record profits. If we can balance that out, I think we'll have more money in the system to make sure that the consumer or the patient's not getting screwed, and the doctors feel like they're being adequately compensated.
Gotcha. What do you have to say about maybe the pros and cons of the value-based care model? What do you think is the benefits that allow, but also maybe the difficulties that, I've heard is typically it goes down into sometimes there might be cherry picking that happens, or, hey, there's things that people don't usually see of the outcome. What is the outcome? Is there something that you want to touch on there as well?
I think the philosophy is the right philosophy because it's ultimately about quality and cost. So, and that's what value-based care is all about. Is you want to drive quality up, you want to drive costs down, and so it's the philosophies around sharing the burden with the clinician. That in a fee for service model, of course, for those who don't know what that is every time I see you, I get paid. So my incentive to see you, the sicker you are, is higher because every time I see you, I get paid. Value-based care model, we say, no, you share in the risk of that. The onus is on you for getting that patient well. And so the theory is that you will be incentivized then to make sure that you're delivering the best possible care, getting the best possible outcomes so that you get paid that bundle of payment and you are getting enough out of that bundle of payment so that it justifies the cost of that quality that you delivered. So it's a framework is a really good framework, but like anything else, it has externalities and costs. Like you said, cherry picking happens. In that model, what's my incentive to see a really risky patient? A really risky patient that's going to cost me more time, more money to care for, create potentially bad outcomes that then dings my value-based care score and causes me to lose money. So the theory of the model is great. There's, I think, a lot that needs to continue to be optimized and worked out. But I think ultimately there's no doubt that the doctor needs to be on the hook for quality outcomes. A fee-for-service is a broken incentive model. I have no incentive for you to get better. I get paid more if you're sick. And so the more there is sharing of responsibility for the patient's wellness, I think that's good. We need to think about how that system doesn't get gamed and how do we ensure that higher risk patients are getting the level of care they deserve. All that needs to be continued to be worked out.
Gotcha. I think one thing that I heard, especially from this one executive, was, when it comes down to fee for service, right? A lot of the times, right, I guess the trope, right, a lot of people hear, right, is the, patient-doctor relationship is really sacred, right? But the thing is, you ask most people, hey, what's going on with your doctor, right? What do you really know about them, maybe in the primary care, right? And they don't really know, right? And so one thing that this guy was mentioning was that essentially, right, the relationship, even though it might seem very transactional, it has its outcome, right? And I was talking to a leader this morning, about what their process has been, and they've implemented value-based a lot, but now going into kind of the new year, one thing that they're thinking about is actually transitioning into a hybrid approach. So what do you have to kind of say about maybe the benefit of the fee-for-service model, and do you think I think a lot can be said about value-based care and it's the right track, but, is there maybe a way to actually implement that as well in a hybrid approach? I'm not sure if you...
I think that may be ultimately the answer to our entire, like we talked about this earlier, and I talked about a tiered model and giving, doctors kind of the choice on what model they want to play. Like I know I speak to a number of surgeons that said, well, I've opted out of Medicare altogether. I'm only doing cash pay now. I'm only accepting the pay. Now, if you are in a socioeconomic demographic and you choose to play in a space where your patients can afford to pay for a $10,000, $15,000 surgery, maybe by all means, power to you. And for the others that want to be paid by a payer, there's a model there as well. So maybe in a tiered system that we create, and this is obviously incredibly complex in how you implement all this, but that's exactly where you go, is that there are fee-for-service models, and you can kind of play in that space, and the patient needs to have full awareness that they're seeing a doctor that's in fee for service and lots of patient education on the implications of that, what that means. And there's also, in like value-based care hasn't gotten full traction, right? It's still something that is getting some penetration and some uptake, and people are starting to see kind of the quote unquote the value of it, but it's still got a long way to go to get kind of full penetration. So we still have lots of fee for service out there. So we're in a bifurcated model as it is today.
Yeah.
And I think we need to optimize what that looks like going forward.
Okay. I think one thing to mention and to note is I think the industry has a lot that it needs to do. What is one thing that you think will actually help bring the change that people want to see?
Well, I mean, when you say people, there are different constituents, obviously. There's the patient, there is the doctor, the providers, there's the payers. Ultimately, I'll go back to what I said. I think everybody should want this. We want lower costs, we want more equitable healthcare, we want less burden of disease, and we want the highest quality care possible in our country. Like, I think we would all align saying that's not controversial. We want high quality, low cost, we want to make it available to everybody, and we want to reduce the burden of disease. So my emphasis will continue to be on utilizing technology intelligently. So when we look at the operations of a health system, we are reducing unnecessary cost. We're leveraging technology to lift the availability and the quality of the care, that we are getting into a more distributed healthcare model, leveraging the best technology for remote care, etc. And that we are putting a lot more resources into wellness and prevention. That's where the biggest shift needs to happen, so that we're not spending $4.5 trillion anymore and people aren't burdened with incredible amounts of disease. So that's where we need to go.
Gotcha. Speaking on maybe controversial, I guess on this take, do you think there's a place and something that's fair or a claim that actually, some providers and clinicians and physicians have about actually the need for them getting compensated under different things, especially in value-based care? Do you think they have a good claim there, or you think that's just outright no, you guys get compensated enough? What do you kind of think about that?
Well, I think the problem isn't how much they're compensated. There's a relativity question, and I'll give an example of a study that was done at Harvard. And Harvard, in a study that was done a long time ago, asked their students, if I were to give you right now a salary that was above market and if I give you, I'll make up a number. I'll give you $85,000 salary, and you knew that your peers were making $80,000. Or I gave you a salary that was $95,000, so $10,000 more than I just offered you, but you knew your peers were making $110,000. Which would you take? Now, the rational person would take the $95,000. It's $10,000 more than you offered me. But humans are in this. We can't help it. We're in this relative mindset all the time, and we're measuring ourselves against others, and we're measuring ourselves against yesterday and thinking about tomorrow. Where the problem is that it's not that doctors aren't paid well and they've got comfortable lives, is that they've seen a decline in the amount that they're making. And nobody wants their income to go down. Everybody wants their income in their careers to go up. And so that, I think, is one of the biggest parts of the challenge that we face is many doctors, if you look at kind of the curve of orthopedic surgery, with inflation factored in, what have you, they're making 10% less than they were not long ago. Who wants their income to go down by 10%? I don't think anybody does. So that's the conundrum that we're in with respect to the compensation side of the equation. I don't know, other than driving a lot of cost out of the system. There's only two levers: see more patients, lower costs, or get paid more through payers. That those are the only levers we have for making sure that our clinicians. For me, nurses are ones that we really need to think about, because they do a significant amount of work, a lion's share of the work. They do incredible amounts of work. They're heroes. Making sure that they're well compensated, and that's a profession that we draw people into, because there's a nursing shortage as well. They're burned out, and we need a lot of really high-trained, high-skilled nurses to do the incredible work that they do. So that's a constituent that I'm very concerned about.
Gotcha. I love that. What advice would you give to a new entrepreneur that actually wants to dive into the digital health or telehealth space? What would you give to them?
Well, one, I would encourage you that there is incredible need and incredible opportunity for the next very wealthy entrepreneurs to be created as a result of the significant need state that we're in. So one, I would encourage you to think about that. I would encourage you to think about how you can play a role in prevention and wellness, because I think that's where we're going to really unlock value. If you're thinking about spaces, I would also encourage you to think about where are the fires that, like I gave that Dr. Dasa example earlier where he said all these innovations that are trying to push us forward, what about just things that will help us, that incremental innovation that will help us do our jobs better and more efficiently and help put the fires out? And so there's opportunity there. And the other thing I would tell you to do is be patient with your forecasting and where you think the trajectory and the penetration that you can get, because it's a very slow, painfully slow moving space, particularly if you're trying to sell into health systems. So I found private practice to be a lot easier to work with. So that's another thing, is to really think about, is there a private practice angle for you to advance and work through versus going into health systems? And then be really thoughtful and mindful about your penetration and your entry strategy on those key influencers and people that are really important, that are shaping the conversation, and getting to them first, because that'll help propel your trajectory.
I love that. I love that. And pairing with that advice, is there any other innovation potentially outside of AI that within the next 5 years you think will be very interesting, especially for these entrepreneurs?
Yeah, I mean, look, I think remote care, right? That doesn't necessarily need to have to be AI, but there's a lot of devices that we can wear now that allow us to monitor various things that are going to become more important in real time, real-time detection of detection and prevention of risk. So the whole telehealth space, the distributed care space. I'm in food as medicine, and we need more science, we need more energy, we need more resources in designing things, breaking the back on the food model that we have, because it is driving us, it is literally making us ill. You could go across the spectrum in health and wellness. There are so many areas of advancement that are happening that, it's just a great time to be in the health and wellness and healthcare space, because there's enormous opportunity.
I love that. We like to do a lightning round here, so I'm going to give you 3 quick questions that you could give quick answers to. Are you ready for it?
Let's go.
Okay, let's go. So the first one is, what do you think is the biggest myth in digital health?
Well, for an entrepreneur, that if you build a really great technology that solves a problem, all of a sudden you're going to get all this adoption. It just doesn't happen that way, unfortunately. So that's the answer. Is it takes a lot of grind and work to get the adoption advance.
What's one of the biggest healthcare predictions that you are seeing in the next 12 months?
Well, I'll give 2, and one is an unfortunate one. The other is, I think, a good one. The first is, I think costs are unfortunately in the near term going to go up. We have a lot of people that are getting more sick and getting older, and there's just healthcare inflation in general, that the healthcare costs will go up. The other is, I think you're going to see continued proliferation of remote care and telehealth, and continued investment in the food and nutrition side of things, because we've woken up to the harsh reality of the world that we're in, and I think both of those will see significant traction.
And then the last one, what's the best advice you've ever received and actually about innovating in healthcare?
Well, I would say just best advice on innovation in general is, and this applies to healthcare because it's just such a tough industry, is be deeply, deeply passionate about the problem you're trying to solve. Because those long days and nights, those times of doubt and worry where you think you might fail, or that, oh my God, here's something that there's another thing that I need to overcome. It's your passion and your love for the problem you're trying to solve that's going to take you through those really difficult days and difficult challenges. So healthcare is no different. It is a beast, and if you love what you're doing and you truly believe in it, you'll grind and you'll put in the discipline of overcoming those hurdles, and breakthroughs will happen. It's just remarkable that when you put in the effort and you've got the right ideas, these break. Like, I just got an email from the U.S. military, and my eyes popped open on how much they're planning on consuming of my product next year if their funding and all that stuff goes through. The company will be on a trajectory that is insane, but that just happened to happen. It didn't happen to happen because we've been working on this for years, but the email was a shock and a surprise in terms of the order of magnitude, and that's because we put in the work for years and years and years. So just be patient with the process, live your love and your passion for what you're doing, and really focus on the fundamentals, and you've got a shot.
Thank you for your time and your insights. Before we wrap up, is there anything else that you'd like to add or share with the rest of the audience?
Just the main thing around, I encourage, if you want to ever reach out to me and bounce ideas off of, I like really supporting entrepreneurs. Entrepreneurs are the ones that are going to, I talked a lot about policymakers and policy and government because I think there is an important role to play. But ultimately, we are an economy and a country that's driven by innovation. And I think it's going to take as many smart innovators as possible to help reverse this incredibly bad trend that we're on. So I encourage you to jump into wellness in the healthcare space and be super passionate about it.
Thank you. Thank you again for your time and for joining us here on the K in Clarity podcast. As well, with that, where can people find you, learn more about you? Could you share more about your details on that?
Yeah, I'm on LinkedIn, so I regularly post thought pieces there. So it's Eziah, Eziah on LinkedIn. That's generally the kind of the place that I'm most active. My company's website is mend.me. You can certainly, shoot me an email if there's something that you want to discuss personally, or a collaboration opportunity, or even if it's an idea that you want to get some support on. I supported a young entrepreneur the other day thinking about a really interesting drink idea, and that's something that drives passion in me. So I can be reached in those two ways.
Well, thank you again for your time today.
Thank you, Mezue. Yeah,
All
pleasure.
right.
It was an enjoyable conversation.
Thank you. Bye.